You think doctors memorize 10,000 facts because they're smarter than you. Wrong. Medical students score average on IQ tests, but Johns Hopkins graduates can diagnose 50 diseases from memory while you forget your grocery list. Here's what they know that you don't. Most people think memorization is about reading something over and over until it sticks. That's why most people are idiots. Doctors don't read their textbooks 15 times. They build illness scripts. And if you understood how illness scripts work, you could memorize anything 10 times faster than you do right now. Chapter 1. Chunking beats cramming every single time. Your brain can hold about 7 items in working memory. George Miller proved this in 1956. 7 plus or minus 2 chunks. That's it. So when you try to memorize 100 isolated facts, your brain treats each one like a separate file. It's useless. You hit capacity in 30 seconds. Doctors don't memorize isolated facts. They chunk information into illness scripts. An illness script is a story. Patient type, clinical setting, symptoms, timeline, diagnostic tests, treatment. That's one chunk, not 40. When a cardiologist sees chest pain, they don't recall 12 separate symptoms. They recall the myocardial infarction script. Middle-aged male, crushing substernal pain, radiates to left arm, diaphoresis, elevated troponins. Aspirin, heparin, cath lab, one script, one chunk. Adel Gewin wrote about this in Complications. He said expert doctors have hundreds of these scripts filed away. They pattern match in seconds. You're still trying to remember facts like a computer. Your brain isn't a hard drive. It's a pattern recognition machine. Feed it patterns. Here's the concrete example. You want to memorize the signs of heart failure. Average person makes a list. Shortness of breath, edema, fatigue, elevated JVP, crackles, S3 gallop. 6 items. You'll forget half by tomorrow. A doctor builds a script. Elderly woman. History of hypertension. Gradual onset dyspnea. Can't lie flat anymore. Swollen ankles. Lung exam sounds like Rice Krispies. Heart sound has that extra beat. Treatment is diuretics and ACE inhibitors. That's a story. Stories stick, lists don't. But here's the problem, though. Chunking gets information in. It doesn't keep it there. Chapter 2, Passive review is a complete waste of your time. You think rereading your notes is studying. Wrong. Rereading creates the illusion of mastery. It feels smooth. It feels easy. So your brain thinks it knows the material. Then the test comes and you blank. This is called fluency bias. Roediger and Karpicke destroyed this myth in 2006. They tested students who reread material versus students who practiced retrieval. 1 week later, the retrieval group remembered 50% more. Rereading is a trap. Medical students get destroyed by something called pimping. That's the actual term. During rounds, the attending physician asks rapid-fire questions. What's the diagnosis? What's the mechanism? What's the next test? Wrong answer means you look like an idiot in front of the team. It's brutal, but it works. Because it's forced active recall under pressure, your brain has to pull the answer from memory. No notes, no highlights, just retrieval. Make it stick calls this the testing effect. Every time you force your brain to retrieve information, you strengthen that neural pathway. You're not reviewing. You're rebuilding. Most students reread their notes 5 times and wonder why they fail. Medical students get pimped daily and remember for decades. The difference is retrieval practice. Here's how you apply it. Close the book. Open a blank page. Write everything you remember about the topic. No peeking. You'll feel stupid. Good. That friction is learning. Then check your gaps. That's where you focus next. If you're studying biology, don't reread the chapter on cellular respiration. Close the book and draw the Krebs cycle from memory. You'll forget half the steps. Perfect. Now you know what to fix. Hit subscribe before you forget. We fix leaky brains here. Chapter 3. Timing beats effort, and you're getting the timing completely wrong. You think if you study harder, you'll remember more. Wrong. Your brain is a leaky bucket. Hermann Ebbinghaus proved this in 1885 with his forgetting curve. You lose 50% of new information within 1 day, 70% within a week. Doesn't matter how hard you studied. Forgetting is automatic unless you interrupt the curve. Doctors use spaced repetition. They review information right before they are about to forget it. Not random review, timed review. The spacing effect is one of the most replicated findings in cognitive science. Bjork and Bjork showed that spacing out study sessions produces better long-term retention than massed practice. Cramming puts information into short-term memory. Spacing builds it into long-term memory. Most medical students use Anki. It's a flashcard app built on spaced repetition algorithms. You see a card, you rate how well you knew it. The algorithm schedules the next review. Easy cards come back in months. Hard cards come back tomorrow. The system forces you to review at optimal intervals. No guessing. No wasted time. Here's the concrete example. You need to memorize 50 pharmacology drugs. Average person reviews all 50 every day for a week. Waste of time. You're reviewing things you already know. A doctor puts them into Anki. Day 1, all 50 cards. Day 2, only the ones you missed. Day 4, the hard ones come back. Day 10, everything resurfaces. Day 30, only the tough ones remain. By month 3, you see each card maybe twice and remember all 50 forever. That's efficiency. But here's the problem, though. Spaced repetition keeps facts alive. It doesn't teach you when to use them. Chapter 4. Context is the difference between knowing and applying. You think memorizing facts means you can use them. Wrong. Recognition is not recall. Application is not memorization. You can know all the symptoms of pneumonia and still miss it in a real patient, because real patients don't come with labels. They come with noise. Anders Ericsson studied expert performance for 30 years. His research is the foundation of the 10,000-hour rule, but everyone gets it wrong. It's not 10,000 hours of repetition. It's 10,000 hours of deliberate practice. Deliberate practice means working at the edge of your ability with immediate feedback. Doctors don't just memorize illness scripts. They practice applying them under realistic conditions. Medical schools use case-based learning. You get a patient scenario. 50-year-old male, fever and cough for 3 days. Now he's short of breath. What's your differential? What tests do you order? What's your treatment? You have to pull from memory and apply it in context. That's the gap between students who pass and students who become great doctors. Application under pressure. Joshua Foer wrote about this in Moonwalking with Einstein. He trained with mental athletes who memorized decks of cards in under 2 minutes. They don't have better brains. They have better systems, and they practice those systems in competition conditions. Memory isn't about storage. It's about retrieval under realistic constraints. Here's how you use this. Stop studying in isolation. Study in context. If you're learning history, don't memorize dates. Answer essay questions under timed conditions. If you're learning programming, don't review syntax. Build a project with no documentation open. Force yourself to apply what you know when it's hard. That's where learning actually happens. Chapter 5. Interleaving makes you slower now so you're faster forever. You think mastering one topic before moving to the next is efficient. Wrong. That's called blocking. It feels productive because you get into a rhythm, but it teaches your brain to recognize patterns only when they're grouped together. Real life doesn't group problems by chapter. Rohrer and Taylor tested this with math students in 2007. One group practiced one type of problem at a time. The other group mixed problem types randomly. During practice, the blocked group performed better. They felt confident. But on the test 1 week later, the interleaved group scored 60% higher. Mixing topics forces your brain to identify which strategy to use. That's the hard part. That's what transfers. Doctors don't study cardiology for a month, then switch to neurology. They see a heart attack, then a stroke, then a fracture, then pneumonia all in one shift. Their training reflects that. Medical exams mix cases randomly. You need to diagnose based on the presentation, not the chapter heading. Interleaving builds that skill. Here's the concrete application. You're studying 3 topics. Topic A, Topic B, Topic C. Average person does A on Monday, B on Tuesday, C on Wednesday. Useless. Do a then B then A then C then B then A. Mix them every session. It's harder. You'll make more mistakes. Good. Mistakes during practice mean fewer mistakes when it counts. But here's the problem, though. All these systems only work if you're practicing the right things. Chapter 6. Feedback is the only thing that turns practice into progress. You think more practice makes you better. Wrong. More practice makes you permanent. If you're practicing the wrong thing, you're just getting better at being wrong. Ericsson was clear about this. Deliberate practice requires immediate corrective feedback. Without feedback, you plateau. With feedback, you improve. Medical training is built on feedback loops. You make a diagnosis. The attending corrects you. You suggest a treatment. The patient outcome tells you if you were right. You present a case. Your peers ask questions you can't answer. Every single interaction is a feedback event. That's why doctors improve fast. They can't hide from their mistakes. Make It Stick dedicated an entire chapter to this. The authors interviewed pilots, surgeons, and athletes. The best performers seek out feedback aggressively. They want to know what they're getting wrong. Average performers avoid feedback because it feels bad. That's why they stay average. Here's how you build feedback into your system. 1. Use testing as feedback. Every practice test shows you what you don't know. 2. Teach someone else. If you can't explain it simply, you don't understand it. 3. Join a community. Study groups, online forums, accountability partners. Other people see your blind spots. Use them. If you're studying alone with no feedback, you're guessing. Doctors don't guess. They get corrected daily until they're right. So here's what you actually do. Stop treating memorization like reading. Chunk your information into stories and scripts. Use active recall, not passive review. Space your repetition with a system like Anki. Practice applying knowledge in realistic conditions. Interleave your topics so your brain learns to discriminate, and get feedback on everything so you're not practicing mistakes. Doctors aren't smarter than you. They have a system. You just didn't know the system existed. Now you do. And if you're still memorizing the way you did in high school, you're choosing to stay average. That's why I made the video breaking down how to build a second brain using the Zettelkasten method, because memorization is step 1. Connection is step 2. Links on screen.